So I'm going to be doing my central venous access device dressing change. So for my supplies, this is the patient's mask, my mask, clean gloves, ruler, sterile gloves, alcohol swab, 2 CHG swabs, skin prep, bio patch, transparent dressing, and tape, and hand sanitizer. So to start off, I would come in the room. Hi, I'm Jessica. I'm going to be your nurse today, and then I would perform hand hygiene, wash my hands for 20 seconds per CDC guidelines. So today I'm going to be removing your dressing for your central venous access device, and you should not feel any pain. Can I get your name and date of birth? Do you have any allergies? And I would also ensure patient privacy and do all environmental safety checks. So I'm going to raise the bed to a working height and lower the side rails, and then I can start. So perform hand hygiene, put on my mask, and then I'm going to ask the patient to turn his head away from the insertion site, and then provide the patient with the mask. Alright, so perform hand hygiene again and put on clean gloves. And then I'm going to inspect and palpate the site for any redness, swelling, which I don't see any of. Then I'm going to remove the transparent dressing toward the catheter insertion site. That goes in the trash, and then remove the bio patch, which goes in the trash. Then I'm going to use the ruler to measure the catheter length and compare it to what was documented last to see if it had migrated at all. So then I'm done with my clean gloves and perform hand hygiene again. Then I can put on my sterile gloves, and this is my sterile field. So first I'm going to clean the site with the alcohol, and then being sure not to tug on the catheter site, I'm going to clean in circular motions for 30 seconds. Next, I'm going to use my first CHG swab to scrub around the catheter site for 30 seconds in a back and forth motion. And then using my second CHG swab, I'm going to clean the catheter from the insertion site upward for 30 seconds. Next, I'm going to use the skin prep and let it air dry. And then next, I'm going to apply the bio patch and the transparent dressing. So now that that's on, I can remove my sterile gloves, hand hygiene, and I'm going to use grab the rest of the catheter and tape it to the patient. And then I would also label the dressing with my initials, the time and date that I changed this dressing. And then this would all go in the biohazard as trash. And then I could put the bed back to normal height, raise the side rails, give the call light to the patient, and wash my hands for 20 seconds per CDC guidelines. I'm done.